Item number 12, I don't see Holden, but I do see Assemblymember Rodriguez. Item number 12, AB 1163, Healthcare Services Plan and Health Insurers, Agents and Brokers, Notice of Contract Changes.
Good afternoon, Mr. Chair and Senators. AB 1163 would prohibit healthcare service plans and health insurance plans from making material changes in their contracts with insurance agents or brokers without providing reasonable notice. The bill proposal is in response to a situation that arose last December when a carrier sent notice to their agents that the commission would be significantly reduced in 48 hours. This notice was issued on December 23rd, 2014, and the reduced commissions would take effect on December 26th, same year. The bill will continue to include provisions for reduced notice if the changes are mutually agreed to or if the changes are required by federal or state law. We have agreed to take the clarifying amendments that is in the mock-up that has been distributed to you. In Section 1, we have replaced the terms agent or broker with solicitor to be consistent with the Health and Safety Code. The second amendment, as noted in the mock-up, is to reduce the notice requirement from 60 days to 45 days. The third amendment will delete Section 1C at the request of the Department of Managed Healthcare. This change will allow the Director of the Department of Managed Healthcare to enforce these contractual agreements. The bill is sponsored by the California Association of Health Underwriters, the Independent Insurance Agents and Brokers of California, and the National Association of Insurance and Financial Advisors, who are here to testify in support of the bill. I respectfully ask for your aye vote.
Thank you, Mr. Chairman. Senators, Julianne Broyles here on behalf of the California Association of Health Underwriters. We want to thank your staff and all of the time that you have spent in helping make this bill come to the point where it is, where we believe that we've removed all opposition to the bill. It would not have happened but for your staff. We do think that the bill, as it is now proposed to be amended, is one that is fair on all sides. We think that as the bill came, and as Assemblymember Rodriguez noted, it came out of the turmoil from the market after the ACA went into effect. It really did highlight how vulnerable agents were in terms of our agent agreement. We think this is a good requirement to have in statute and would ask your aye vote. I would like to introduce you.
Just quick clarification, you still do have opposition just for your, because you made a statement that it has removed the opposition.
We had talked with the plans yesterday.
So, well, okay, well, we'll, all right.
Yes, sir.
Okay.
Yes, sir. I believe,
my understanding,
we have.
But we'll let them come up and either be neutral or opposed, but I thought that they were still opposed.
Okay. Hopefully have addressed their concerns. I'd like to introduce our president, Michael Lujan, who is our new president of the California Association of Health Underwriters, to make a brief remark.
Good afternoon, Mr. Chair. Good afternoon, Mr. Chair and Senators. Honored to be here today and speak in support of 1163 and shed a little light on the subject from the agent's perspective and the consumers we serve. We're very proud of the role that agents have played in helping reduce California's uninsured number. Very proud. I think the numbers have been widely echoed and reported here in the state, from reducing the uninsured rate from 22% to 11% in the first year of implementation of the ACA. And licensed agents played a significant role in that. I think what, just to highlight a point around the timeliness of notice and why that matters so much, I think for the licensed agents who enrolled about 45% of last year's total enrollment and about 75% of the in-person enrollment, the timeliness of that notice is very critical in that, much like the tax season and how tax preparers are head down and busy in their work, the abrupt notice that are significant and material changes are very disruptive to the enrollment process and the consumers we serve. So it's our request that, that this notice be provided and create a standard that doesn't exist today in the marketplace. Most independent agents are Main Street small businesses themselves in nearly every community in California. Our members believe that this change is more critical than ever in light of the Affordable Care Act and the required compression of the open enrollment period each year. Changes that occur to the agent agreement, like the one issued that Julie just mentioned in late December of 2014, was effective only 3 days after the date of that notice. So that's the abrupt notice that we're referring to. And it occurred in the middle of the Affordable Care Act open enrollment period, which could never be fairly evaluated during this time crunch. It's important to note that at the end of each year now, agents work with hundreds of thousands of Californians to help them obtain or renew their health insurance coverage. Over the same period, many employer groups are also renewing their coverage, and all of this is overlaid with agents aiding seniors and others with Medicare enrollments that happen during that same seasonality. An agent agreement, to clarify, an agent agreement or producer agreement is a written contract stipulating the arrangement between an insurance agency and the insurer or HMO it represents. The important details such as ownership of the renewals, required levels of service, reporting deadlines, survivorship, and the general duties and responsibilities of each party are usually set out in these agreements and contracts. Most agent agreements contain provisions that address how and when the notice of change and the agency agreement can be implemented, and those will vary anywhere from typically 30 to 90 days. So I'll wrap it up by just saying I'm very grateful for the support that we have that arrived at what we hope will be an unopposed, and ask for your aye vote.
Good afternoon. Sherry McHugh, representing the National Association of Insurance and Financial Advisors. We would also like to thank you and your staff in the author's office for working with us and hopefully addressing many of the remaining concerns. We believe AB 1163 does represent a good compromise, and it gives agents and brokers adequate time to make the business adjustments that they need to make within their agencies to make sure that they can accommodate the changes that are imposed upon them by the plans and the carriers. So thank you very much, and we urge an aye vote.
Thank you.
Mr. Chairman, members, John Norwood on behalf of the Independent Insurance Agents and Brokers of California. I think this is a very reasonable bill. It's really about just treating your business partner with respect. In the property casualty arena, companies have to give the agent or broker 120 days notice of any change, not of material change, of any change in their contract. So given that this is a lot less than that, it's a very reasonable bill. Thank you. I urge your support of the bill. Thank you.
Anyone else? Opposition?
Mr. Chair and members, Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. First and foremost, I would like to thank the chair, the author, and the sponsor for all their hard work. We do have these amendments out to our members, so today I'm not prepared to be removing our opposition, but we are reviewing it. We thank the author and sponsor for reducing the days to 45. That was a big concern for our members. They are looking at the material definition. I know initially we like to see it just limited to commissions. So we're hopeful that we will have better news to share in the next couple days, but as of today, we still are opposed to the bill, but look forward to working as it moves forward. Thank you.
Christy Weiss on behalf of the California Association of Dental Plans, and we are in the same position. We've had an opposed unless amended position on the bill. Very much appreciate the amendments and think they'll go a long way with our members. Just need to go back to the plans and go through that process and revisit our position. Thank you.
Nick Luizos on behalf of the California Association of Health Plans, and just associate myself with the previous comments. Thank you.
Thank you. Questions from the members? So just a question, and I know that the opposition was looking to obviously reduce the days, which you agreed to, and they wanted to just limit it to commissions and bonuses. And I was supportive of all four of your requests. So I can see the right of survivorship, but explain to me, and I'm still supportive, why indemnification of the agent or broker and then errors and omissions, how is that germane to, because I seem like to you, the most important has got to be the bonuses and then the commissions. That's what you're more interested in. So just kind of educate me why those two provisions are still very important in this issue.
To ask Mr. Lujan to come back on up and answer. For us, the indemnification and the errors and omissions, those are amendments that were added by the Assembly Insurance Committee. The indemnification is what we have to do in case the insurance company or a claimant comes in or a policyholder has an issue where we're required to indemnify the insurance company for any action that policyholder might make. I know that Mr. Lujan has probably a better answer on the.
So it wasn't you didn't want to have the last two put in, it was put on you by the insurance committee?
Insurance
All right,
committee.
okay. So you may want to clarify.
Yeah, a brief clarification. Every agent agreement or contract includes some definition of duties and responsibilities, which cover a broad range, the amount of errors and omission coverage that must be obtained or maintained, submission requirements, any number of notices that are outside of the scope of just commissions. So while commissions are important and changes, I think the one in reference in 2014 took the number almost down to 0 with only 3 days notice. So while that's a significant part of it, all of those other matters are also material and would affect the enrollment process you're right in the middle of.
Okay. All right, thank you. Seeing, Senator Nielsen.
Someone Rodriguez or maybe one of the witnesses can differentiate the amendment here. It substitutes solicitor for agent broker. What's the distinction? What would be a solicitor as opposed to a broker or agent?
The difference is that under the Health and Safety Code and the Knox-Keene Act, they use the term solicitor instead of agent. In the insurance code, it is health insurance agent.
But why would this solicitor make the bill more palatable?
That particular issue was just conformity with what the Knox-Keene currently has. It wasn't more palatable. It just was a conforming issue.
More semantics than anything else.
Correct.
Okay.
See no other questions. Is there a motion? Moved by Senator Roth. Would you like to close, Assembly Member?
I respectfully ask for your aye vote.
Thank you, Chair. Is recommending the support. Item number 12, AB 1163, do pass as amended. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Aye. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Roth, aye. Wolk. Aye. Wolk, aye.
Currently has 6. We're missing 1 member, enough to get out, but we'll put that bill on call.
Thank you, Senator.
We're at item number 11, AB 1162 Holden, Medi-Cal tobacco cessation.
Senator. Good afternoon. Mr. Chair and members, today I present Assembly Bill 1162, a bill that will fight tobacco dependence and reduce health care costs for California. AB 1162 clarifies which tobacco cessation treatments are covered under Medi-Cal to ensure the coverage is comprehensive for managed care and fee-for-service patients. Smoking is the leading preventable cause of death in the United States, but in the Medi-Cal population, the risk of smoking are even higher. The national smoking rate is 18%. However, the smoking rate within the Medicaid population is 30%. According to the CDC, 70% of smokers want to quit, but only 6% succeed every year. There are effective medications to help smokers quit, but Medi-Cal patients experience significant barriers to medical help, including long wait times for appointments and a decreasing number of primary care providers. AB 1162 requires that all 7 FDA-approved medications and all 3 types of counseling are covered. It also prohibits prior authorization for the over-the-counter drugs and at least 1 prescription drug. The Department of Health Care Services recently published new guidelines for tobacco cessation coverage in response to the Affordable Care Act that requires health plans to cover all 7 drugs with at least 1 without prior authorization. This was a great first effort, but it falls short of the federal guidelines which recommends all drugs be offered without prior authorization. Perhaps they recommended this because there are other ways to control costs besides prior authorization. For example, dosage and dispensing restrictions, duration limits, refill thresholds, and generic drugs. To address the chair's specific cost concerns, I'm willing to amend the bill from allowing unlimited quit attempts to 4 each year. I'm also amending it to prohibit prior authorization only for over-the-counter treatments and at least one prescription treatment. A copy of those amendments are being passed out to you now. I understand there are concerns that the removal of prior authorization for some drugs will raise costs, but research has shown that the long-term savings of comprehensive coverage outweigh initial costs. The status quo is expensive. Treating one case of lung cancer costs over $40,000 on average, while the average cost of a quit attempt is just over $400. The CDC estimates that in 2004, Medi-Cal spent $2.2 billion on smoking-related illnesses. However, this bill is not just about saving the money, saving the state money, it's about changing lives. AB 1162 will ensure all patients have easy access to these life-changing services. And it's for these reasons that I ask for your aye vote.
Thank you. Anyone like to speak in support of the measure?
Mr. Chair and members, Autumn Ogden with the American Cancer Society Cancer Action Network. We are a proud co-sponsor of AB 1162. This bill will provide clarity to all plans, physicians, and patients regarding tobacco cessation services that would be covered for all Medi-Cal populations. Tobacco-related diseases are the leading cause of death and diseases in California, claiming more than 40,000 lives annually. This costs the state billions of dollars annually to treat tobacco-related diseases. Smoking is a difficult habit to quit, and it takes many quit attempts, which is why the federal government made tobacco cessation part of the requirements for accepting Medi-Cal expansion. AB 1162 is based off of clinically proven effective methods in treating nicotine addiction and falls within the federal guidelines for approved treatments and ensures greater access and timely treatment through the Medi-Cal program. Other states are already currently doing this, including Massachusetts. In 2006, they made comprehensive tobacco cessation treatments available to their Medicaid enrollees and saw dramatic decreases in smoking rate from 38% to 28% in just 2 years, saving the state over $10.5 million in tobacco-related costs. Tobacco addiction is costly and a difficult habit to break. When trying to quit, it is essential that we remove as many barriers as possible. We believe that AB 1162 will achieve this, and we ask for your aye vote. Thank you.
Thank you. Anyone else?
Thank you. I'm Samantha Payon with the American Lung Association in California, and we are also proud co-sponsors of 1162, which would ensure that Medi-Cal members are receiving the help they need in order to quit smoking for good. Since 2008, the American Lung Association has produced a report called Helping Smokers Quit, which highlights why it is so important that smokers have help to end their nicotine addiction. Helping smokers quit not only saves lives by improving one's health immediately, but also saves money from lower healthcare costs and increased workplace productivity. However, in order to realize these benefits, every smoker needs access to a comprehensive tobacco cessation benefit, and quit smoking treatments must be provided at no cost and be easy to access. As our report indicates, too many states have policies that make it harder for Medicaid enrollees to access treatment. This is particularly disturbing as Medicaid members have higher rates of tobacco use than the general population. Last year's Surgeon General's report concluded that today's cigarette is more deadly and addictive than ever, which makes it even more vital for tobacco users to get the help they need in order to quit smoking for good. AB 1162 would ensure all Medi-Cal members are put into the best possible position to succeed by providing a comprehensive tobacco cessation benefit and removing barriers to this treatment. We respectfully request your aye vote.
Thank you. Anyone else in support?
Yes, good afternoon. Jamie Morgan with the American Heart and American Stroke Association, also a proud co-sponsor of this bill. And we believe it's essential to ensure this vital population have access to comprehensive cessation services and urge your aye vote. Thank you.
Thank you. Support? Name and
Jasmine Gordon on behalf of the California Black Health Network in strong support.
Jerry Jeffy, California Chronic Care Coalition, in support.
David Ford for the Association of Northern California Oncologists and the Medical Oncology Association of Southern California, in support.
Jimmy Jackson, Biocom, in support.
Betsy Armstrong with the County Health Executives Association, in support.
Laura Fitzgerald on behalf of the California Life Sciences Association, formerly known as CHI and Bay Bio, in support.
Amber King with the Association of California Healthcare Districts, in support.
Alex Hawthorne with the March of Dimes and also the California Dental Association, in support.
Dr. Donald Lyman, representing California Medical Association and the California Academy of Preventive Medicine, in support.
Lydia Bourne, representing the California Division American Academy of Pediatrics, in support.
Elizabeth Landsberg with the Western Center on Law and Poverty, in support.
Brandon Roberts with the Health Officers Association of California, in support.
Opposition? Questions? See no questions. Oh, opposition? Sorry, I didn't see you.
Thank you, Mr. Chair, and members. Nick Luizos on behalf of the California Association of Health Plans. I want to thank the author, his staff, and the supporters of the bill for the level of engagement that we've had on this bill. And we are analyzing the new amendments that were shared with us last night and early this morning, the final version of those. And so I'm not prepared to remove our opposition at this hearing without further analysis and feedback from our plans. But again, we do think the level of conversation. I will just say that any bills that impact our Medi-Cal managed care plans and require them to absorb additional costs, those bills are very difficult for my members because the rates that are paid to Medi-Cal managed care plans today are not reflective of today's costs necessarily. My plans are getting paid rates based on data that's been sent to the state 2 years ago. And so for some reason, that process takes a long time. There is a proposal to change that process to make the rates more prospective, but today they are retrospectively based. So what we've discussed with the author is some sort of way that we can conform this bill precisely to the Department of Health Care Services policy letter on tobacco cessation drugs. Now, at a glance of these amendments moves us in that direction. We don't see complete conformity yet, but we are continuing to look at those amendments, but without any sort of mechanism to increase the rates to my plans to the extent that there's an expanded benefit is problematic for my members. And a perfect example of that are the Hep C drugs that were introduced last year. It took a special kick payment from the state of California to help pay for the cost of those drugs, again, because today's rates are not reflective of today's costs when things change. So we do respectfully continue to oppose today. If there's a change in our position based on the new amendments, we'll communicate that to the author's office and to the committee. Thank you.
Thank you. Anyone else? Questions? Seeing no. Yeah, Senator Pan.
Well, thank you. Thanks very much. I think, in my mind, this is a very, very important bill. We need to, as I think it was testified, that to help people quit, it's not only going to help their health, it's going to help financially as well. I would probably say, agree with the health plans. We need to do more to help out with if the rates aren't actuarially sound, then we need to be sure they are and that the plans have the resources they need to be sure we can pursue preventive measures like this. I mean, this is, because in the end, although we may talk dollar and cents when we come to rates, the outcome is really better health. And I think that's what this bill is really about. I guess just one question for the supporters in terms of quitting. I don't know if you have the data at your fingertips. What's the average number of quit tries does it take for a typical smoker to quit? I know tobacco is very hard to quit.
Yes, and actually it's an average of 7 quit attempts.
Okay, that's what I've heard as well. So as you can see, 7 quit attempts. We're going to give, so here we're going to give people 4 in 1 year. And so, you know, I think we just got to keep that in mind. And also in terms of the impact, I don't know if the numbers you shared were just for the smoker alone, the savings that you get from the person who stops smoking. But as a pediatrician, I work a lot with families, and I have parents who are smoking, and they're trying to quit, but their kids are going to the hospital with asthma and prolonged colds and ear infections and so forth, which also increase costs even as the parents are struggling to try to quit and try to get access to smoking cessation service. So I think the costs may be larger than is projected if the projection is only for the immediate person who's trying to quit, not for the people around them as well. So I'm pleased to support this bill and move the bill.
We have a motion by Senator Pan. Seeing no other questions, would you like to close?
I would just thank the committee for its consideration. Again, thank the chair for his thoughtful amendments, and I respectfully ask for your vote.
Thank you. It's item number 11, AB 1162, do pass as amended. 2 appropriations. Chair is recommending support. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Hall. Mitchell. Monning.
Aye.
Monning, aye. Nielsen.
Aye.
Nielsen, aye. Pan.
Aye.
Pan, aye. Roth. Roth, aye. Wolk.
Currently has 5, enough to get out. We have some members absent. We'll place that bill on call.
Thank you, Mr. Chair.